Okay, so have a seat. Hi, my name is Zoe and I go by she, her. What's your name?
I'm Sydney. I also go by she, her.
Okay, awesome. So what are you here for today? It's for low back pain?
Yes. My back has been hurting me for a couple of years now.
A couple of years?
Yeah.
Okay. Did anything specific happen or?
Nothing like traumatic injury-wise, but
Okay.
I think from the 11 years of gymnastics
Okay.
had some effect on it.
Mm-hmm. So there was never a moment where the pain started? It kind of just came on over time?
Yeah.
Okay. So would you say that the pain is very often, or is it only occasionally when you do certain movements, or is it every day?
It is more often than not, but I think because of my posture, like how I study, because as I'm hunched over right now, that's kind of what causes it to be a bit more painful, I'd say.
Okay, so it occurs a little bit after having an improper posture. It's not like
I don't wake up with it.
Okay, and it's not like you'll do a false movement and then you feel it. It's more of a posture thing from sitting a long time.
I think so.
Okay. If you're standing for long periods of time, do you also feel it?
Sometimes. Yeah.
Sometimes. Okay. So either one, but not at the beginning of the day.
No.
Okay. Do you have any initial management that you like to do to help relieve the pain, or you kind of just deal with it?
Sometimes I will stretch or ice my back, but for the most part, I kind of just deal with it.
Okay. On a scale of 1 to 10, how bad would you rate the pain when it's at its worst?
Probably a 4 on 10. It's not very debilitating, but it's definitely noticeable.
It's noticeable. Okay. And compared to when it started, how many years ago did you say?
I want to say, unfortunately, over 10 years ago.
10 years?
Yeah.
Okay.
It's been a problem since I was probably about 10 or 11.
Okay. And did you play gymnastics until that age or longer?
I started gymnastics when I was 2 and stopped when I was about 12 or 13.
Okay. So
mainly because of my back.
Because of your back pain? That's when you stopped?
Yeah.
Okay. Okay. Have you had any previous injuries to your back?
No.
No?
No.
Nothing specific? Okay.
Nothing specific.
Just this. No surgeries?
No.
Okay. Have you seen any other healthcare professionals or had any diagnoses for this?
For this in particular, I haven't had any diagnosis, but when I was younger, I would go to massage therapists and chiropractors.
Okay.
I found massages used to help. Chiropractors would relieve some tension too, which was lovely, but nothing obviously lasted.
So the massage felt good? Okay. Did you have long relief afterwards?
Don't exactly remember.
No? Okay, that's okay. Cool. So, what's the quality of the pain? Do you say it's dull, sharp, tingling, throbbing? How would you describe it?
Ooh, I feel like it would be more of an achy pain.
Okay.
It doesn't feel super deep.
Okay.
Or anything like that.
Superficial? A
yeah.
little bit?
Yeah. No tingling or anything like that.
No, okay.
No.
So
it just stays there.
The pain is localized.
Yeah.
Does it go down your legs?
No.
No, and you don't feel it higher up in your back?
No.
Mostly low back?
Yeah.
Is it central, the pain, or both sides, or one side?
It's mainly on the right side that I feel more often. Sometimes I could also feel it on my left, but it is mostly on my right side.
Okay.
Yeah, it's not directly on my spine, but
yeah. So to the side.
Yeah.
And so you said that it hurts mostly after sitting for long periods of time. Do you ever notice you're just bending over, or some you do a specific movement that makes it hurt more?
I don't think so. I feel like sometimes if I'm trying to stretch the muscles, I will bend forward, and I could feel some tension in it, but I don't know if it necessarily makes it worse.
Okay. That's okay. Is there something that relieves your pain when it does hurt? Just the ice? Or rest?
Yeah, either rest or just if it's from like being hunched over too long, I will like try to stretch and like move it around.
Mm-hmm.
Or if I'm like lying on my stomach, sometimes I'll like put a pillow under my hips, because sometimes lying on my stomach will like cause pain in the lower back.
Mm-hmm. Okay.
But otherwise.
Okay. Have you had any different, well, before I ask you if you've changed anything recently, can you just tell me a little bit of what like your everyday life activities look like, occupation, training schedule, just so I can know what kind of activities you do?
I'm just a student, so my day-to-day is being in school, sitting down for hours, and coming home and sitting down and studying for hours.
Okay, so a lot of sitting.
Yeah, no training anymore. I stopped sports after high school.
Okay. So your history is mostly like sports related. Did you ever have like any training that you did like outside of your sport, maybe gym or something like that?
Yeah, I would go to the gym like not super frequently, but I would usually do exercises that weren't super like heavy weight or anything, just because sometimes if I would do like what's it called, like deadlifts and stuff like that.
That hurts?
Yeah, sometimes it'll cause a lot of pain in my back.
Okay.
But I've had people like make sure that my form is right, so I'm not like straining it. So I don't know if it has something to do with my form or just a mechanical issue.
Mm. So like you had someone help you with your form and it still hurt even when you corrected the form?
Yeah.
Okay. So there haven't been any like bigger changes recently that you've like started a new activity or like, so you've been in school for about like
2 months, about
2 months. Over the summer, did it get better?
Ooh, I don't know if I necessarily noticed it over the summer.
So maybe less pain over the summer?
Yeah.
Okay. So it could be possibly because of the amount of sitting you do in school.
Yeah.
Could be the change, the difference. Okay. So that's about it for my history questions. I just have to quickly ask you for any possible more serious issues. So I just want to make sure that I don't need to send you to see someone else before we start our evaluation. So just going to quickly go through some of the questions with you and just say yes or no if you experience any of it. So do you ever have any persistent pain at night, unusual lumps or growths, any unexplained weight loss, or unwarranted fatigue? No, none of that? Okay. Do you ever experience shortness of breath that's outside of like exercise? Like, no, okay. Dizziness, heaviness in the chest, or any pulsating pain?
No.
No, okay, good. Do you experience frequent severe abdominal pain, vomiting, or bladder problems? Okay. Do you have any changes in hearing or vision, or severe headaches?
No.
No headaches. Okay. Could you possibly be pregnant?
No.
No? Any night sweats, joint or swelling redness?
No.
Okay. And just for a few yellow flags, do you have any circulatory changes or skin changes?
No.
No. Vertigo?
No.
Or random fainting? Sorry.
No.
No? Okay. Okay, so that clears everything. So just based on our history, some of my thoughts currently, it sounds a little bit muscular just because of it being mostly on one side. If I was more concerned that it was an issue at the spine, I wouldn't necessarily see it so presented on one side. So muscularly, you could have an erector strain, but there could also be an issue that's coming from the pelvis. So it's hard to say right now exactly what it is. Just for the sake of what we're going to be looking at, we're definitely going to be looking at some lumbar stability tests. I want to see how your pelvis moves. So are your two pelvic bones moving properly together? Also, are there any abnormalities? So are they even? Is there possibly an upslip? You didn't say there was any traumatic injury, so I'm not really leaning towards that. Okay. Not leaning too much towards that, but it could happen over time through muscle imbalances also.
Yeah, I'm also sure that at some point in gymnastics I definitely fell.
Yeah. So it's possible.
Yeah.
So we could look at, for upslips, we can look at if you have lumbar instability, and also muscle related weaknesses.
Sorry, the screen went black.
Okay. Yeah, so maybe an erector spinae, a strain, or maybe a QL strain. We're also going to look at all the musculature. Are they even and in force? And then functioning also, we're going to see, are there any imbalances in your movements?
Okay.
So from there, we'll have a better idea at the end of possibly what it is. So if you're okay with it, do you want to move into our evaluation?
Yep.
Yeah? Okay. So we're going to start with a bit of an observation. So I want to look at your posture, your gait, and then a few functional movements. So let's first start with your posture. So I'll just have you stand. And I'm going to look for anything obvious.
Do I face you? Away from
So start by facing the wall. And try to make it feel as natural as possible. Don't try to change it for the sake of the evaluation. Okay. So I see just from this angle, your knees go back a little bit. So because of that, your hips are a little bit forward. That's the only really obvious parts. Should we show for the camera? So you can try to stand a little further. Yeah, it's a little hard to see with her pants.
Yeah, the hyperextension of the
Yeah,
knees.
so the knees are a little bit hyperextended, and because of that, her pelvis is coming a little bit forward, and that's going to put more stress on her low back. So there could be a bit more of a curve because of that. That's off the bat, that's all that's really noticeable. I'm going to have you face me now. Nothing looks really abnormal. I'm looking at the knees. There's no valgus or varus, really. The feet, are they pronated or supinated? They don't look pronated. And that's it. I'm not going to try to look for really... I'm not going to start nitpicking everything to find something. So that's good for posture. Let's look at gait. So we don't have that much space, but we'll try our best. Let me move this. Okay. I can move the bench a little. So go ahead and walk towards me. Okay, and walk away.
Sorry, my ankle's
You're
cracking.
cracking a little. Okay, do it 2 more times. So I'm looking at the movement of the pelvis. I'm looking, is one hip dropping as she's walking? You can just keep going as I analyze a little. Is one hip dropping more compared to the other one? I'd say maybe the right leg, the hip does drop a little bit more. Just keep going. I like to do this one a little long. Ideally, we'd have a longer hallway. But yeah, we could see the right one does like to drop a tiny bit more, but it's not a huge thing. Maybe if we tested your running and you became more fatigued, then we'd be able to see more. When she's fatigued, is that more of an issue? Or just from walking a little bit, it was a small difference. So that's it. Let's do a squat now. So I just want to see how you perform your squat. Do whatever feels most comfortable. You don't have to think about keeping your feet in a certain spot. Do whatever feels best for you. Okay.
Facing you?
Yeah, we'll do it sideways too now. Let's just make sure we can see. Okay, go ahead. Okay. So we can see, you can keep going as I speak. You'll get a little workout in. Great. We can see a small lordosis of the back. When she goes, she likes to stick out her hips a little bit. It's a bit of an anterior rotation, especially when she goes down. Let's do one more, yeah. Yeah, that's the only thing that's very noticeable. As for the knees, they weren't wobbling. The feet weren't caving in. The knees weren't caving in. But the hips were pretty anteriorly rotated when she was going down, especially. Like, it enhanced it more in the squat than when she was just standing. So I also want to look at a step up now. So we have, is this okay, the little step?
Yeah.
So I want to see you do a side step. So you can stand sideways to the step, and I want to see you bring your right foot onto the step, and then stand up.
Do you want to stand with, like, both my feet on, or just both?
Well, like, bring yourself up, and then touch the other foot to the step for balance. Okay? Alright, let's keep doing that. Okay, so what we see here is that, go ahead and do one. What's happening is the other side of this hip here kind of stays down, and as she's coming up to the top, it's hiking up. It's catching up near the end of the movement. So let's compare it to the other side. Try not to change it based on what I said. Just try to do it as naturally as possible. So we're seeing sort of the same thing on this side. Do it one more time. It likes to catch up near the end. So the pelvis isn't moving in one piece, but the ilium that's not being lifted is staying down compared to the other one. Okay. So we did squat, single leg, step up, and I want to see a single leg balance. Let's bring this down again. So you can just bring one foot up, and we're going to hold this for about 15 seconds. So this is the left leg. So here we're seeing how well can she maintain it.
Not very well.
Just as, because then when we compare to the other side, we want to see is one side stronger. So go ahead and do the right side, yeah. We're also looking at the levels of the hips. Does one of them like to come up higher? Does one drop? She's bringing this leg in a little bit. So there's a slight rotation. Okay. Let me see how you did the other one just one more time. Yeah. So we see here, the knee kind of comes out straight, but when she lifts the other one, go ahead, it likes to rotate inward. So we'll analyze that later to see what that could possibly mean. Okay, that's it for my functional testing, I believe. We did gait, squat, step down, single leg balance. One more I want to do is a single leg bridge, so we can do it on the table. Which one do we have? You're right here. Can we see well? Yeah. Okay, so we see well. So what I'm going to have you do is you're going to go into a bridge. You know what that looks like? Yeah? And so what we're going to do is just do it a single leg. So do it how you feel right. Okay, let's do the other one. Okay, they look pretty even. I'm looking again at how level the hips are. So if one side drops when she lifts or it tends to hike up more, there could be an imbalance there. Let's do it one more time. Good. Got a nice crack. Yeah. So they look even. I didn't see any serious drop of either hip. So good. So next what we're going to do is we're going to go in and clear the joints above and below. So since the affected area is likely the lumbar spine based on what you told me, we're going to go and clear the pelvis, the thoracic spine, and the hips. Sounds good? So I want to start first with hip and sacrum, pelvis, sacrum area. So you can lie on your back again. You can stay where you were. So for the hip, we're going to do first active, So let's start with this leg. Wait, your right side hurts? Okay, so we'll start with the left side. So let's go ahead and bring your knee up to your chest. Good, no pain. She has a lot of range. And then with a little overpressure, nothing's blocked. It's nice and springy. There is no pain? Okay. So just tell me if anything hurts. Okay. So let's do the other side. Good. A little overpressure. So the flexion is good. We're going to look at your abduction. Right?
I might just hit the wall though.
Okay, you can put your head on the other side, and it'll be fine.
That works.
That's good. So, for the abduction, I'll get you to bring yourself outward this way. Perfect. And I'm going to add a little bit of overpressure. Nothing. Okay. Hold on. Okay, let's do the other side. No pain?
No.
Okay.
Yeah, I'm sorry.
That's alright. Let's look at your rotation. So I'll get you to flex one knee. And you're going to try to bring this foot out towards me. Good. It's fine. And the other side. Good. Perfect. So that's good. You did flexion. So that's all the active and passive. We're going to do that resistant.
Okay.
So I'm going to come to the other side. So I can bring you up to this position. I'm going to get you to bring your knee towards your chest, okay? So go ahead and push. We're going to do it for 5 seconds. Okay, good. Strong, no pain?
No.
Okay, so for your rotation, you're going to try to bring your foot into my body, okay?
Mm-hmm.
So go ahead and push. See, it's fine.
Mm-hmm.
Okay, no pain.
No.
And then the abduction, you can push out towards me.
Okay.
Okay, everything's good.
Mm-hmm.
Let's do the other side. Go ahead and push towards you. Okay. Rotation. You're going to push into me. Okay. And the abduction, you're going to push out towards me now. For the abduction, we can also do them at the same time if we see her moving too much to the opposite side. So you can go and push both out at the same time. Good?
Mm-hmm.
Good. So all the hip ranges are cleared. We're going to quickly look at your pelvis. So I'm just going to do a passive compression and distraction, okay?
Mm-hmm.
If you feel any pain or anything, go ahead and tell me. Is it okay if I touch your pelvic bones?
Yes.
Okay. So I'm going to start by the compression. Okay, no pain?
No.
And the distraction. And we're looking for in the back, not where I'm touching. Is that okay?
Mm-hmm.
Okay, good. So that's fine. We're going to move on and look at your thoracic. Let's do our little step stool. Your feet can reach the step stool?
Yes.
Okay, good. So for thoracic, I'm going to get you to go into a slump. So we're going to first look at your flexion. So go ahead and slump until I feel T12 move. So that's good. That's okay.
Mm-hmm.
And we're going to do it at the same time as lumbar since we're going to do it in one fluid movement. So you can go ahead and keep going. Reach in between your toes. Do you feel any pain lower in your back?
No.
Okay. I'll just add the overpressure, sorry. Go down into it. And a little overpressure. Good. For the thoracic, I didn't add the overpressure because I knew we were going to go further into the flexion. So let's now look at your extension. So you can go back into a bit of a slumped position and try to start extending your back from the top and then vertebrae by vertebrae extend from the bottom of your back. So try not to start the extension from the bottom of your back. Okay, good. So that's thoracic. Do you feel any discomfort? So now you can start extending from lower in your back. Does this cause discomfort?
A little bit.
A little bit? Okay. So I'm just going to write that down.
And it doesn't like linger. It just like, once I'm out of that position, it doesn't hurt anymore.
And it hurts on your right side?
Yeah.
Okay. So that was actively an extension. How would you rate the pain out of 10?
Just like a 2. It was like just discomfort, but I definitely felt it.
Okay. So I just need to do a little bit of overpressure on that. So if you can go back into that position. Is this okay?
Mm-hmm.
Okay, so I'm just going to add a little bit of pressure. Does that cause more pain?
I don't know if it's necessarily more, but I do still feel it.
You still feel it? Okay.
Yeah.
Okay. Would you rate it maybe a 2 out of 10 still? Or was it more?
Yeah.
Ish? Okay. 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 So, since there was pain active, we'll go ahead and do passive, but I'm just going to finish the ones that we have here. So, we're going to look at a side bend. So again, I'm at T12. Go ahead and side bend starting now. Yeah, you can side bend away from me. No pain. Okay, keep going. Any pain?
Not pain, but I do feel like a stretch.
A stretch on the right side?
Yeah.
Okay. It doesn't hurt though?
No, it doesn't hurt.
Okay. So I'll do the overpressure too. Is that okay?
Yeah.
More of a stretch or?
A little bit.
But it doesn't hurt?
No, it doesn't hurt.
Okay. So we're going to do the other side. Go ahead. Start. Okay, good. There, it's fine.
Mm-hmm.
And then keep going. How does this one feel?
Less of a stretch.
Less of a stretch?
Yeah.
Is there any
but no
pain anywhere? No. Okay, I'm just going to do a little bit of pressure. I'm stabilizing at the hip, and I'm pushing at the shoulder. Okay?
Mm-hmm.
Side bends are good. Let's look at your rotation. So go ahead, rotate away from me. That's all right.
Mm-hmm.
Keep going. That's all right.
Mm-hmm.
And or pressure.
Yeah, that's fine.
Okay, let's look at the other side. So go ahead, rotate. Right there is okay. Keep going until you can't. Okay, how's that?
That's fine.
And or pressure, do you feel anything?
No, it's fine.
Okay, so rotations and side bending is okay. So I'm going to just note that down. The only problem that we saw was on extension. So we're going to go do that passively, but first let's do the resistant. Do you have a pillow? Do you have a pillow?
I can go.
Oh, no, it's okay.
Yeah.
Do you mind if there's no pillow, or?
I don't mind, but there is a pillow right here anyway.
Okay.
Okay, it's a water pillow.
Wow. It's not going to explode?
No.
Okay.
Should be fine.
Okay. So, we have to make sure both of our feet are on the floor. So she has the bench and one of my feet is off onto the floor. So what we're going to do is all that but resistant, okay? So I'm going to give you a hug. And first what we're going to do is you can go into flexion. Resist. We're going to do it for 5 seconds. Okay. That was okay?
Mm-hmm.
Extension. How's that one?
It's fine.
No pain. Okay. Side bend into me. Push. Okay.
Mm-hmm.
And side bend away. That one's okay?
Mm-hmm.
Okay, let's rotate. So choose a side. Okay. Okay, and then the other side. Were all those okay?
Yeah.
Okay, so they were all strong and none of it caused any pain, so that's good. So we did those that covered thoracic and lumbar, really. We could have done them a little bit slumped. for the thoracic, but there wasn't any pain found. So that's good. Sorry. Let's see what's next. Yeah, we have to go ahead and do the passive lumbar spine. So I'll have you lie on your back. No, actually, I'll have you lie on your stomach, sorry, because we're only looking at an extension. Okay. So, maybe I'll go on the other side. Sorry.
Yeah, okay.
That's okay, I just want to pause. Okay. So you can just come a little closer towards me. So try to relax as much as you can when we're doing these. You can let me unbend your knees. Is that okay?
Mm-hmm.
Okay. And I'm going to come underneath and bring them up to extend the spine. Is that uncomfortable?
A bit of discomfort, but it hurt more with doing it actively.
Hurt more actively? Okay. Try to relax as much as you can. We're going to do it one more time. So you're pretty flexible. Does this hurt?
No, it's just a bit of discomfort, but I wouldn't say it hurts, but it weirdly feels more on my left side doing that. I'm sorry, that's weird.
No, it's okay. Okay.
But yeah, that one didn't hurt on my right side.
Alright. That's good to know. So, we're going to go into our special tests. We're going to start with our lumbar ones, so a few instability tests. So since you're, I want to do the pheasants test, and it's really similar to what we just did. We will just do it one more time, because the procedure is a little bit different. So you can lie like this and just try to be relaxed. I'm just going to bend your knees. And since she's flexible, we don't see any extra extension of the back. So this isn't painful at all?
No.
Okay. So I want to do the prone, oh sorry, I have to push down on the spine. So I'm near L4, L5, my whole palm is on the back. I'm just going to push down and bend more. Do you feel any discomfort?
No.
No? Okay. Okay. Next one I want to do is prone segmental. So this one is off the side of the table. Are you comfortable with holding on to the table?
Yes.
Okay. So just so we can see it, we're gonna. Okay. Do you want it more angled? There you go. That's good. So you're gonna hug the table. Okay. Are you able to reach around? Because you're going to be lifting your feet off the
Yeah,
floor.
I'm good.
You're okay? Okay. So do you feel any... I'm going to put a little pressure around the affected area. Do you feel any pain?
No.
No? Okay. So let's just proceed with the test anyway and see if we find any changes.
Mm-hmm.
So what you're going to do is lift your feet off the floor. Does this feel more comfortable for you?
Honestly, no.
No?
No.
Worse?
A little bit.
Okay. So that tells us that it's probably more muscular than instability.
Mm-hmm.
Because if you had an instability, lying in that position with my pressure would have hurt, and then the activations of the muscle kind of stabilizes your spine. So since we saw the opposite, we're leaning a little more towards muscular. Okay. I want to do the H&I test. So for this one, around here again. So what we're going to do is we're going to move in a pattern that resembles an H. So we're looking at the top of your head, and you're going to be drawing the H with your head. We can start with the I. So what you're going to do is you're going to flex forward as much as you can. And then you're going to go into one of the I sides. So you're going to side bend. Do you feel any pain in any of these?
No.
Okay. And then do it with some extension. And then side bend? Okay. Do any of them feel painful or weird?
Nope.
Okay. So now we're going to look at the H. So what you're going to do first here is side bend and then flex.
No, that's fine.
Okay, let's do it to the left side.
I feel a stretch.
That one?
Yeah.
So when you went to the opposite side.
Yeah. Yeah, like that. Wait, okay. And then backwards.
Okay, let's try back now. Is that okay?
Mm-hmm.
And then the other way.
That's also fine.
So it was just on the H on the front left side, but on that same side in the I position, did you have pain?
No.
No?
Not too, like... I feel it more than doing it on the opposite side, but it's not painful, but I do feel like a stretch.
Okay. Try the H one more time to see if it's still happening to the part that was painful. Do you still feel it?
A little bit.
A little bit? Okay. So was it both or just one of them?
I think just one.
Just one? Okay. So
Okay. I don't even know. I feel it more, but I wouldn't say it's painful doing it. No. But I feel it more when I'm doing it toward the...
So it could be like slightly hypomobility or instability just because it wasn't very positive in really one of the specific areas.
Mm-hmm.
So we'll keep that in mind. Now I want to do some MMTs. So, yeah, bring the table out. So first I'm going to do some endurance tests with you, okay? So we're going to start with the erector spinae group. So it's a dynamic extensor endurance test. So what we're going to do is I'm going to have you lie down on your stomach. You're going to lie prone. Yeah, that's good. So what we're going to do is you're going to place your hands behind your head, lie down, and then what you're going to do is extend your lumbar spine while lifting the head, chest, and ribs from the table. And we're going to try to hold this for 20 to 30 seconds. So I'm also looking at her feet lifting. Is she compensating anywhere? For now, everything looks good. Okay, it's been 30 seconds. How was that?
Fine.
No pain? Okay, good. So let's look at the QL dynamic horizontal side bridge. So what I'm going to have you do is you're going to lie on your side. You can bend these knees because your knees are going to be the support. And you're going to come up onto a side bridge. So you're going to lift your pelvis off the side of the table. And I'm going to see how long you can hold this. Do you feel like you know how to do it?
I think so.
Okay. So good. Good. Yeah, right there. So for this one, we're looking, can you hold it about 20 seconds? And if, depending on how long she can hold it, it gives a different grade for the test. So how's this one?
Fine.
Okay, good. Let's do the other side. Okay. When you're ready. Okay. Did they feel any different, the two tests?
No.
They were both fairly easy. Okay, good. Let's do the abdominal endurance test. So I'll have you lie on your back now. And for this one, you're going to put your hands behind your neck, and you're going to try to clear your scapulas from the table.
And I keep my feet on the table?
Yeah, you keep your legs straight. So you're going to come up and try to clear your scapulas from the table.
Okay.
You ready? Okay, good. And maintain this. And we're going to record, can she do this for 20 to 30 seconds. But she has to maintain both of the scapulas off the table. Is this one okay?
Mm-hmm.
Okay. You dropped them a little bit.
Yeah, I felt that.
You felt that?
Yeah. But no pain.
Okay, let's try to do the same test, but put your arms crossed over your chest, and we can see if you can keep the scapulas off the table.
Okay.
There you go. So keep that position for 20 seconds. You can do it. Let's go. Oh, for 4 points, it's 15 to 20 seconds. So if she does 15, then it's also good.
Why are you shaking?
You're good. 3 more seconds. Okay, good.
Oh.
So you got to score 4.
Oh, that's fine. I'm good at that.
Good job.
That's hard to do after doing the first one.
Yeah.
It's a good workout.
So I want to test some glute strength. So I'll have you side lie for the glute med. You can face the other way, yeah. Okay. So what we're going to do, you can bend this leg for support if you like. We're going to bring this one up, always making sure that the pelvis isn't rolling back or forward. So maintain this position and point the toe down. Down. Yeah, down. So what I'm going to do is I'm going to push down and forward towards you, okay? So try to maintain this position. Okay. Any pain?
No.
No? Okay. So you can flip over to the other side. Okay, we're going to do the same thing. Bring it up and try to keep it here. Okay, and release. So I did feel like this one was a little bit stronger. So I'd give this one a 5 and the other one a 4+. Okay? We're going to do glute min too, so you're already here. So it's the same thing, but I'm just going to push straight down and the foot's position is in neutral. Okay? So go ahead and maintain this. Okay, good. Let's look at the other side.
Oh, gosh.
That's difficult. Okay, here. And try to maintain here. Okay, good. So yeah, I feel it's the same thing. I wouldn't necessarily give both a 5 though. Maybe I'd do a 4+ on the left side and then a 4 on the right side. Okay, let's look at glute max. So you can lie on your front. You can bend this knee. Bring it off of the table. Try to maintain this position, and I'm going to stabilize right here. So go ahead and keep it here. Good, it's nice and strong. Let's do this side. Okay, push up. Okay. So again, I feel this one was a little bit stronger. So this is a 5 and this is a 4+. The left side is the 5.
I felt it in my back though.
You felt
the
it?
left side, not the right. But I felt it in the right side of my back.
So when you're doing this one, when we're doing the left one, you felt it on your right side of your back where you usually feel your pain?
Mm-hmm.
Okay.
Don't know what that means, but yeah.
Okay. It's good to know though. Because of the time, we're gonna do our palpation. Alright, do I keep going or?
You can go until 50 and Jackie said if you go a bit
over. Okay. So that's good for my MMTs for today. Let's do our palpation, and then I'll see what I have time left for, okay?
Mm-hmm.
So I'm palpating the erectors. Tell me if you feel any pain, or if it's where you normally feel your pain.
I think that's fine. I feel like it might be a bit like more out, yeah. I feel it usually around there.
Mm-hmm. Is it on the bone here?
Not necessarily directly on it, but like around that region.
Okay. So I'm at her crest. Is it okay if I fold your pants?
Mm-hmm.
Okay. So I'm at the crest here. Is the pain above the crest or below?
That is usually right here.
Right there? Okay. So where she's pointing, it's really right above the crest. Right here?
Mm-hmm.
Okay, so that could be the insertion of the QL. If it's below, it's a little bit more gluten. And if it's a little more down and centrally, it's more PSIS. Do you ever experience the pain near here?
Sometimes, yeah.
Sometimes. Okay, so she does have a little bit of pain near the PSIS sometimes. And near the QL, because it's a little more out. But not really down here. Okay, so it's looking a little more like it could be the insertion of the QL or near the PSIS. Okay, so should I do a few more things? Okay.
Yeah, like 5 minutes.
Okay, since we have a little more time, we're going to do some of the flexibility tests. So, I want to see your modified Thomas test, or since the table's high, we'll just do the Thomas test. So you can go ahead and lie on your back. What you're going to do is you're going to bring one leg up to your hip, hold it close to your chest. I'm looking, is there any tightness here? So the leg isn't coming off the table and she's able to go really far. So let's do the other one. Okay, both are really good. I want to look at your favors. So I'm going to put you into a figure 4. I'm going to stabilize opposite side and let it drop. So it goes pretty low. Like it's touching my thumb. Let's do the other side. And hold on, I'm just going to switch sides. Go ahead and drop. Do you experience any pain near the PSIS anywhere in the back? Okay. So sometimes if it's like a PSIS pain, you can feel it there. So it's good that you didn't feel it in this. Yeah. Let's look at your standing forward flexion, okay? You can come stand. So you can just move forward a little bit. I'm going to be here. So I'm just going to roll down your pants, okay? So I'm on the 2 PSIS, and I'm going to have you bend forward, and I'm seeing what the movement's like. So the right side went up a little bit more. I just want to do it one more time. Go ahead. Okay, so this time the left side went up more. Let's do it one last time, just to be sure. Hold on, I'll go a little bit lower. Okay, go ahead. Okay, yeah. So we see the left side does drag more than the right. Okay? So because of this, the standing forward flexion, the side that drags more is the side of the lesion. So the left side could be the side of the lesion. So with palpation, we can see if there's a rotation. So if you go ahead and lie on your back again, you can stand whichever way. Whichever.
My stomach or back?
On your back. Your stomach here. Did I say back? Okay. So I'm just going to see on her sacrum, is there a rotation based on where the hemibases sit? Okay. So nothing very apparent. None of them, neither feels like really forward or back. So I'm not gonna, since it's not very obvious, I'm not gonna say that one is more forward or back. If I was nitpicking it, I can maybe feel that the that the right is a little bit more anterior, but they're so similar that I don't think it's a valid test to do for her. Okay, so for the sacrum, there was a bit of ilium movement that was like incorrect in the way that they weren't moving together. For the sacrum, I didn't feel a really big of a rotation, so it could be more coming from like a muscle imbalance. Maybe one is more tight. Maybe one of your iliums is being pulled more into like an anterior tilt or posterior tilt. So that's seeming a little bit more what it is. And since the pain is sort of near the QL region, and well, it's QL and a little bit of PSIS. The PSIS could just be from the improper like ilium movement. There could be an extra stress at that joint, at the SI joint. So that's what I'm thinking so far. I would normally go in and do a little more muscle testing and see if there's any more imbalances, and then we would go in and correct those imbalances. So that's it.
Mm-hmm.